Trach suctioning is a procedure performed using surgical aseptic technique. The nurse will review the physician's orders for prescribed trach suctioning. She will go into the patient's room and identify self to patient using full name, title, and school. Identify the patient using two patient identifiers while comparing the identification band with the S-bar. The nurse will assess the patient for history of allergies and any related allergies to tape, latex, lubricants, or medications while comparing the S-bar. Inform the patient about what, why, and how the procedures will be performed, and assess the patient's respiratory status by observation, auscultation, vital signs, and pulse oximetry. Assess the condition of the trach tube while making sure the inner cannula is locked and that the ties are secure. Provide tools for communication and give to the patient to communicate with. The nurse will now set up and test equipment as necessary. Nurse will then hyperoxygenate the patient. Nurse will aseptically open the normal saline and place it at the end of the table. She will also aseptically open the suction kit, which is now her sterile field. The nurse will don her sterile gloves. Nurse will remove cup and place it off the sterile field. She will remove the sterile suction catheter from package, maintaining sterility, and then pour normal saline into a cup. The nurse will loop and hold suction catheter in sterile dominant hand and turn suction device on. She will place the end of the catheter into the cup of normal saline to test suction and lubricate tip of suction. The nurse will encourage the patient to cough and take a deep breath. Insert suction catheter 4 to 5 inches into trach tube and 8 to 10 inches until resistance is met for a deeper suctioning. Apply suction and gently rotate the suction catheter while it's being withdrawn. Rinse suction catheter with normal saline. Observe patient for dyspnea or cyanosis. Nurse will aspirate 2 to 5 milliliters of saline into the suction tubing for any thick or tenacious secretions. The nurse will then aseptically remove gloves enclosing the suction catheter and discarding all disposable equipment appropriately. Nurse will reassess the patient's vital signs and lung sounds post-procedure and inform the patient of her plans to return to evaluate her in 15 to 20 minutes. Nurse will then document the procedure.